Hello, Soba Vincent, and welcome back to Financial Freedom for the Average Person. And our the next section of expenses that you need to deal with that you can hopefully save some money on is health insurance and drug pricing. Also, in uh, this lesson, we will also talk about go through exercise 11 and finding lower prices on prescriptions. One of my favorite things to do because it is a huge ripoff for people. So, a little bit on health insurance. You're always better off if you can get it from your employer. It's difficult out there otherwise. You have the different Obamacare type options, and there's a few other type of options, and I think it's getting better, but it's still very difficult to have health insurance if you don't have a government insurance or if you don't get it from your employer. And medical costs cause a lot of bankruptcies. And yeah, it is very cheap if you go outside the country. And sometimes, especially if it's something that is not that pressing, it's not necessarily a bad idea. And medical tourism is a big deal, and it's getting bigger. You got to have it. And it's also very negotiable. When you go in, and a good example I have was getting my kids braces. We went in, and they went $6,000, and then I start finding out different places I can promote discounts, and I start, well, can you do it for 2,000 if I paid you cash? No, they're not going to do that, but 5,000 they would. Okay, well, it knocks a little bit off, so you can do that, and and don't feel bashful for doing it. The prices they quote you in the medical field are totally arbitrary in most cases. And the gold standard is Medicare, and Medicare is very good, and but you have to wait till 65. So when I was in high school, and my parents retired at 55 or whatever, and that was kind of the standard. Now the standard is 65, and it really is from the healthcare. So, but it's something else you can kind of plan. If you did want to retire at, I'll say 50, then how do you cover the healthcare for those next 15 years? And and think about it. Find a way to fill that gap. So, now myself and my family, we've been very lucky. I worked in the federal government, and I was also military. And the military retirement is fantastic. So it basically enabled our family to be able to retire. I retired around 54 from my primary job. And there are some options for you. Of course, again, I'm pushing, pushing, pushing. Employer, if you got a good employer, sometimes the grasses may look greener on the other side, but often it's not. I'm military reserve, and my son, he got out of active duty and opted to stay into the reserves. And one of the big drivers was his healthcare costs, dramatically cheaper. Even if they paid him nothing in the reserves, the amount of money he saved on healthcare made up the difference. And you can investigate the Obamacare, the health exchanges. There's these health sharing options and sites out there, and I've met some people that are in them. They seem relatively happy with them. I don't know much about them though. Shop around, and if all possible, avoid Cobra. Horror story after horror story on Cobra. Expenses approaching $1,000 a month for a family for even just a few months. And so, you're better off finding a better option, and maybe better off staying with a job an extra few months while you're finding another one than going with a gap. Just things to think about. Now, one of the areas that I love dealing with are prescription medications. And, and I want to start this off right with a horror story. I was in Carlsbad, New Mexico. I was in the pharmacy getting a prescription, and I see a Hispanic mom coming in, and she was getting a prescription filled for her daughter, and I think it was an ear infection. It could have been, something else. And I could hear, overhear them talking about antibiotics. regular, typical antibiotics. And I think when the woman got her prescriptions, it was over $200. And, and she dug in her purse and she had the cash, um, which also let me know that this is probably an unbanked person. So they're carrying lots of cash, which is unfortunate. And it was kind of devastating. Um, I use GoodRx. I used GoodRx back then. I looked up quickly what I believe the prescription she's looking for, and she could have got it for under $20 if she had just went literally across the street. But we don't talk about health care. We don't share things with people, and we suffer. So, bottom line, before you order anything, check out the cost. Now, there's times when you just got to get it done. I understand that. But if mostly with your routine prescriptions, um, you know, you can do better than you're probably paying. Even with insurance, sometimes going to like the GoodRx or Single Care can, just for no cost, you can come up with something that's cheaper. We'll go over an example of that. Again, everything's negotiable. Mail order options are fine too. I like to shop as I like to tell my wife, I like going drug shopping outside the country. That makes her nervous when I'm talking about buying drugs. But prescription drugs, medications are often vastly cheaper if you go outside the United States. Not really an option for most people, but mail ordering from Canada can be done. All right, so now we're going to take a look and go into exercise 11, and we're going to calculate the drug costs in your local area. So what I'd like you to do is pick a prescription drug, preferably one of yours or one of your family, and then go to GoodRx and just do a search on that drug. And I like GoodRx. And then on a sheet of paper, write down the cost of the prescriptions of the different local pharmacies. And if you want, check out how much you would be with your whatever insurance you have as well, and see, what makes the most sense. And then it's easy to move prescriptions between pharmacies. Most pharmacies will even do it for you. You just need to, make a contact. Taking a little bit of time, but let's see how much money that can potentially save you. All right, so this is actually, I took this one directly out of my book. This is a GoodRx page, and I redid this from my local area, and the results were fairly similar. Okay, and this is a drug I take. I take avorstatin for high cholesterol, low dose, 10 milligrams. I like a 90-day supply. So if you look at the chart here, you can see in one column, it's telling you how much it is if you were just to go into the store and buy it. Okay. And then it's showing you if you were to print the GoodRx free coupon, how much it would be. Now, GoodRx also sells a plan, and they're pushing that really big right now for like $15 a month. And a lot of these simple drugs like this one, the cost becomes zero. But I don't promote that. I do promote trying to find a better price. So they've negotiated this price, and there's several other companies that do this as at GoodRx as well. But now, if you look on here, if you look, I'm gonna start with looking at Walgreens. If you see Walgreens down there, if you were just to walk into Walgreens and order this prescription, they would have charged you $306. Now, with the coupon, it drops to $112. That's still ridiculous. If you went to Winn-Dixie, local grocery store, which is unusual, they tend to be much more expensive. You can see the standard price there, and with the coupon, you can get it for $13. So you're looking at a difference between potentially $100 and $300 just on a 3-month supply of this. And this holds true for almost every prescription drug. The other one that kills me is Walmart, because I always count on Walmart being pretty cheap. They don't even offer you a coupon. It's $80. It still beats Walgreens, but when you look at Winn-Dixie, it's a way to go. Okay. Now, I do this for my stepfather. I go through his prescriptions and I match them up and see which one makes sense. And if it's a few bucks different, we don't worry about it. But, if it's running $30 or $40 a month different, you think about it, it's $300-400 a year that you're leaving on the table potentially, or more. And again, majority of people do not do this. What they do is they go to the doctor, they get a prescription, they say, "Where's your pharmacy?" You send them directly to that pharmacy without taking a look. And it doesn't take but 3 or 4 minutes to do a quick screen. And even if the drug's at one pharmacy, call the pharmacy where you want to get it picked up, have it shifted over. When you go pick up the drug, make sure you've got the coupon from GoodRx or whatever service you're using, and you just saved a bunch of money. All right, bottom line, healthcare is expensive, especially in this country. I went to an emergency clinic in Bali earlier this year. Yeah, we do get around a little bit, and seeing the physician, the prescriptions. It was a Saturday, I believe, in the morning. All of that was $40, and yeah, uh, easy, and that's very, very typical if you're outside the country. Now, in our country, prices are hard to find, and they're not fixed. In Europe, in particular, and other countries, all the prices are right up front. If you're going into an emergency room in Spain, I've talked to people, emergency room in Spain with all the services is $900. That's what it is. That's getting you in. That's all the care. That's the meds. The only thing that might be different is if they're giving you a brace or something. And that even included MRIs for some people I knew. Uh, Very, very reasonable, very fair. But you have the opportunity, to shop around, negotiate. But if you really want to do well, stay healthy as long as you can and take care of yourself. So, um, not to smoke, hopefully, and there's other things that a lot of people do that just take care of yourself. And hopefully you'll avoid a lot of these costs. But anyway, thank you. And we'll move on to our next lesson.